Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Sinar Syamsuddin and the name J1A119075. Kelas Kesehatan Lingkungan 019. Okay, let me present my segment. Journal is ZIKA virus, public health notice. Okay, first, Zika virus outbreak. Zika virus outbreak, a rapidly expanding outbreak of Zika virus infection is spreading in some countries. For instance, one case found average area of Saint Martin on 18 January 2018, another case was in Virgin Islands of United States on 25 January 2019. 10 cases in Dominican Republic, then 8 cases in local region, and 2 imported cases from El Salvador. This virus is also continuous in Haiti, the Caribbean, and Germany. The World Health Organization, WHO, declared the Zika virus outbreak becomes a public health emergency and international concern. Okay, next to Zika virus incubation. Zika virus incubation, the incubation of Zika virus remains unclear. It can last for several days to weeks. Some people will not have symptoms or will only have mild symptoms. The symptoms are similar to other arboviral infections such as dengue fever, conjunctivitis, joint pain, malaise, and headaches. But Zika is diagnosed through PCR and the isolation of virus from blood samples. Serologic diagnosis might be difficult because the virus can cross-react with other flavivirus, such as dengue fever and yellow fever. On the other hand, Zika viral disease is usually relatively mild and does not cause special treatment. 3. Zika virus control. In line with that, the need with Zika virus community certification inaccuracy. It is an important step towards together to prevent the virus spreading in the community. It's a simple, cheap, and easy step such and the T3M program in Indonesia, menguras, menutup, and mengubur. Or 3C in English, which is mean clean the bath of minimum twice a week with brush to prevent the mosquito-like eggs3, close all the water container, and bury the thing so it will not become the place to mosquito-like eggs. In our situation, collect and recount it. Next. The government also has careless intensive surveillance, implementing factor control measures, as well as educating the public about the risks associated with the Zika virus and encouraging them to take and precaution against mosquito bites. Focus efforts to prevent and control should be employed by reducing mosquito breeding through such reduction, reducing contact between mosquitoes and humans, decreasing the number of open spaces that contain natural and artificial water that support mosquito larvae to breed, and reducing the adult mosquito population around the community. Mosquito netting is also needed as mosquito inhibitor because Aedes mosquito have the time or certain hours and the breed. Thus, it is recommended that those who sleep during the day, like babies, children, the sick, or elderly, should rest with the use of mosquito nets. 4. Zika virus control measures in some countries. In Thailand, the effort has been made with the establishment of rating disease unit under the control of the Hospital for Tropical Diseases, Faculty of Tropical Medicine, Mahidol University. The tourists who visit Thailand must pass through a latest sensor method. However, in Thailand International Airport arrival station, travelers identified as having symptoms of particular disease will be directed to the hospital. Cooperation between the parties has been going well, so that efforts to separate of the introduction of disease from country to country can be controlled. Okay, next. In Indonesia, for Indonesia, the national government and the Ministry of Health of Indonesia have issued a travel warning. The citizens of Indonesia who will travel abroad, especially to countries experiencing extraordinary event of ZIKA virus, includes Brazil, Cape Verde, Colombia, El Salvador, Honduras, Martinique, Panama, and Suriname, and the countries that have the status of active transmission, namely Barbados, Bolivia, Curacao, the Dominican Republic, Ecuador, Fiji, France Guiana, Guatemala, Guyana, Haiti, Mexico, New Caledonia, Nicaragua, Paraguay, Puerto Rico, Saint Martin, Samoa, Tonga, West Virginia Island, and Venezuela. Okay, let's go back with the prevention of the disease of Zika virus offers the NH healthy security to prevent, detect, and respond to Zika virus as well as other emerging infections. Require is sustained community and cooperation at all levels of government, the private sector, and civil society. Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh.